Hello YouTube. Today we are studying neural tube defects. Neural tube. So basically, neural tube defects are the most common congenital malformations in CNS. The pathophysiology is very simple. There's a neural tube. It has an anterior neuropore, posterior neuropore. If any of this fails to fuse, you have NTD. So first we'll study about caudal neural tube defects. Very easy. Posterior neuropore fuses at 26 days. If it fails to fuse, we have caudal neural tube defects, which could be spina bifida occulta, meningeocele, meningomyelocele. Okay. If you want to look at pictures, this is spina bifida occulta. This is meningeocele. So basically the meninges are out, there would be CSF, trans-elimination test would be positive. This is meningomyelocele. Here, there could be herniation of spinal nerve roots, which could result in bladder bowel incontinence, also flaccidity of lower limbs. Now we will study cranial neural tube defects, which are also very easy. There would be anencephaly, no brain, could be holoanencephaly or meroanencephaly, or there could be encephalocele, which is defect in the skull leading to herniation of brain. There could be anencephaly, which is defect in occipital bone and fusion of cervical vertebrae. The baby would have a stargazer posture. If you could appreciate, this is the stargazer posture. Okay, so we studied caudal neural tube defects, cranial neural tube defects. Now there is something known as craniorachis, which is basically splitting of the cranium and spinal region. Antenatal diagnosis is very important for neural tube defects. It is done using USG at 14 to 16 weeks. The markers are acetylcholinesterase, which is the best and specific marker, or alpha fetoprotein in maternal serum. Okay. The prevention is very easy. Periconceptional taking of folic acid, which is 400 microgram per day. If the mother had previous history of a child with neural tube defect, she has to take 4000 microgram per day. Bye.